psycho-oncology is actually a short version of psychosocial oncology, and it refers to the mental health needs of individuals with cancer and individuals who are touched by cancer in various ways. So that includes family members, caregivers, and so on. It's essentially referring to the experience of cancer that doesn't have to do with chemotherapy, surgery, or radiation therapy. There continue to be a number of barriers to get people adequate treatment for some of the symptoms we've been talking about. I think one of the most important ones is this sense that, well, anyone would have these symptoms if they were diagnosed with cancer. It's understood, it's expected. So I feel as though this level of emotional, psychic distress is important. It has critical implications for treatment outcomes, and we have to try to identify these symptoms in our patients early and then intervene quickly and effectively. The initial idea was to create a psycho-oncology clinical consultation service. In other words, a service that would be able to provide psychiatric care for inpatients and outpatients with cancer. But as we thought about this more deeply, it became clear that the psychiatric care was one aspect that was part of a larger umbrella of services that we were already providing and part of services that we needed to provide for patients with cancer at UNC. And those other services include things like nutritional support and educational services and symptom management, pain management, and survivorship clinics and so on. So what we did in thinking about the Comprehensive Cancer Support Program is we took a step back and we tried to review the literature and talk with our patients and talk with our providers and ask ourselves the questions, what is it that people need to help support them through their cancer journey, both acutely and in the cancer survivorship phase? And that led to a long list of services, not every one of which is needed by every patient. But what we then tried to do is we tried to put together a comprehensive program, an integrated, interdisciplinary team of individuals who could address what was needed for patients when they needed it and in the right way. We have a program at the Outer Banks where we provide telemedicine consultations in conjunction with an oncologist there. And we've been doing that for the last couple of years. We've seen somewhere over 60 patients, and we evaluate them each time afterwards. One of the surprising things that we found is we've asked people afterwards, did they enjoy the experience of talking with a psychiatrist via telemedicine, and would they do it again? And overwhelmingly, they say yes. And then when we ask them, would you prefer to see someone in person or via telemedicine, surprisingly, more patients say telemedicine. And when we dig a little deeper on that, I think that people like the fact that they can go into their oncologist's office and not into a mental health center. So I do think that there's still stigma with respect to getting mental health services, even in this day and age, and it's unfortunate. I tend to think about cancer survivorship as including four main domains. One has to do with the more traditional medical domain of treating symptoms that may be due to the cancer or its treatment. A second domain has to do with cancer surveillance and screening, because individuals who have been treated for cancer are clearly at higher risk for some cancers and they need to be monitored for recurrence. A third domain I would call psychosocial care. That is the kinds of symptoms we've been talking about, the mental health symptoms, that is more of a clinical perspective. And then the fourth domain has to do with wellness, diet, exercise, lifestyle changes, essentially how to move on in a more global sense in this new age after cancer. At the end of a hard day's work, if I've met with a patient and done a good consultation and feel like my intervention has resulted in something good coming out of this, I'm happy as I could possibly be.